Let me turn it over now to Senator Alsobrooks.
Thank you so much to Chair and Ranking Member for holding this hearing today, and thank you as well to each of our witnesses for taking time to be here. You know, I often speak in this committee about my own experience, and I know that my experience is so similar to so many other Americans. As a caregiver, as a member of what's known as the sandwich generation, and it is true that every single day I balance my role as a United States Senator with that of being a mother and a daughter, ensuring that my aging parents have the care they need as they navigate the health challenges that, if we live long enough, will surely come. So countless Americans share my story and strive to make their own family members live with dignity and access to the care they need, and yet so many are left without the resources or necessary community support, and many more seniors are without family to advocate for them or the resources they need to afford to care, and they unfortunately slip between the cracks. I just can't imagine what the average American does. I have to tell you, in my own experience, I had a really sweet moment just last night with my mother who has dementia, and it was my father has been her caregiver now for the last couple of years. And like so many families, it is often the caregiver who then becomes sick. And so he was recently given a really, really serious cancer diagnosis. And so it has just brought to bear the struggles that so many have with having the care they need at night, and so on and so forth. And so, you know, it continues to help me understand how important this is. So I'm joined here today by tremendous advocates for seniors and individuals with disabilities, including the former Assistant Secretary for Aging and head of the Administration for Community Living under the Biden administration. And I'm also proud to introduce the Strategic Plan for Aging Act, along with Ranking Member Gillibrand, building upon the great work that my state is already doing to support community living for seniors and individuals with disabilities. And so my first question for Ms. Barkoff is, Professor, would you I want to just mention that Secretary Kennedy has gutted the agency that you used to lead with a reduction in force, and I would be remiss if I didn't ask you to briefly share for the record the importance of that agency's work in advancing independence for older adults and people with disabilities.
Thank you so much, Senator Alsobrooks, for that question. ACL is the only federal agency focused on community living for older adults and people with disabilities. And what many people don't appreciate is that ACL does not only fund and oversee and support the incredible programs that we've been talking about throughout this hearing, but it plays a critical role in coordinating across all of HHS and the federal government to make sure that older adults and disabled people are considered in all policies. And as you mentioned, ACL has been significantly impacted by the reduction in force. Less than half the staff remain. The entire policy team, evaluation team, every single one of its regional staff, the grant team, the budget team, the communication team, and external affairs. And ACL is having a hard time doing what it needs to do to be able to play the critical roles in supporting the aging and disability networks and the unique role that it plays in coordinating programs. So I hope that Congress will continue to fund ACL and HHS will continue to staff ACL to be able to meet its statutory mandates and the critical role it plays in community living.
Thank you. And you know, there was, you mentioned the staff cuts, but there have been staff cuts in the proposed reorganization of the Administration for Community Living, as you mentioned, undermine the agency's mission to help seniors and others living with disabilities. And the Baltimore Sun reported last month as well on the disturbing proliferation of unlicensed assisted living facilities in my own state. And these facilities are housing elderly and vulnerable residents in substandard conditions, all in exchange for their Social Security or disability checks. And they're engaging in a practice experts call benefit or senior trafficking. And so, Professor Barkoff, you have extensive experience working both to protect seniors and individuals with disabilities and going after bad actors that abuse these populations from both your time at HHS and the Department of Justice. And so can you give us, talk to us about how the states, how can we give states the tools to better monitor and go after these bad actors and prevent them from operating unchecked?
Thank you for that question. And I also saw this report, and the abuse and neglect and exploitation in these types of unlicensed assisted living facilities, unfortunately, is not limited to Maryland. It exists really across a number of states in these boarding care homes or adult care homes. And it's incredibly important. ACL plays a major role in implementing elder justice, the adult protective services programs, the long-term care ombudsman program, really working with states to prioritize how to identify this type of abuse and neglect, how to make sure law enforcement knows how to work with these networks. And what I can unequivocally say is when you look at, and this committee has had a number of hearings on the resources available to adult protective services and ombudsmen, it is minuscule compared to the serious abuse and neglect that is happening to older adults and people with disabilities.
Thank you so much.